Hi Jo, welcome to Swiss Re. It's great to have you here in Zurich. Tell us a little bit about yourself and where the idea from Wysa came from.
You know, Lloyd, I've now had about 25 years of a career, of which the first half was corporate. And as I started wanting to do more impact work, the need to do something that has a product market fit in the hands of the user and really gives people something they need came about. And initially, Wysa wasn't created as a mental health startup. I went through founder depression as a part of the startup that I created, still a social enterprise. And as a part of that, I realized the power of reframing a negative thought, of cognitive behavioral therapy. And a part of me wondered why that would be always gated behind a diagnosis, why that wasn't something that we could just help ourselves with, why so much effort was being pulled into awareness and stigma and diagnosis when all we needed to do was give people a safe environment to talk, where it will be completely private, where it's all clinically designed, but they can just talk through things and help themselves. And that could be the gateway to therapy and remove the stigma and build the awareness all on its own. So that's where Wysa came about.
Thank you. Over the last few years, obviously, you've done some remarkable things with Wysa. Is it possible for you to pinpoint a couple of those things that really stand out for you as the founder?
But perhaps emotionally, the biggest moment for Ramakant and I, my co-founder and I, was 6 months after launching the app, when the first time we got a message where people report issues. There was a girl called Nora who wrote, "I'm 13, I'm depressed, I tried suicide and you're helping me hold on to myself. And thank you." And that broke our heart and made us realize that no matter what anybody else says, we're going to try to be the number one in the space. I remember 6 months and 10 years ago us saying we're going to be the number one in mental health in the world, and here we are today. The next big milestone came to us with the NHS in the UK, where one of the nurses was a digital mental health specialist, and she became that because a year and a half ago, before she even met us, she had discovered our app, Wysa. And when she met us, she found us at a conference and said, "This is the only thing that works for the age group that I work with, about 14 to 15-year-old people. I cannot give them anything else that works. And a third of the patients that I give this to don't need anything else. So you guys have to go through the nice guidelines. You guys have to publish evidence. You have to come into the NHS pathway." And she then went on to get a fellowship to work with us for free. Then when we could afford us, joined us and became our clinical safety officer and, really opened up the NHS for us.
So Wysa work with governments, you work with public health services all over the world. How does the partnership with Swiss Re complement the other work that you have going on?
Well, think of the health ecosystem as being funded by different players. Very rarely will you have an end user who's dealing with mental health able to pay for that support. So our primary aim is to work with people who can fund that access and make that access really low friction. Now, when you're working with the NHS or the Ministry of Health in Singapore, they can make this available as a public health service. And a company like Wysa that's that small doesn't have the bandwidth or the access to resources to build relationships with insurers across the world. And because we've been able to work with you to create that business case of how mental health support actually lowers risk for insurers, lower risk for patients, and all of the evidence that we've been able to show you, the credibility that Swiss Re brings to the table is having analyzed that, being able to bring that business case back to insurers to say, if you offer this preventative support, you're going to not only be able to create access to all of your members, and especially those who are high risk, in ways that they wouldn't be able to access otherwise. So you're creating radically enlarged access, millions of users at one go. But also these insurers will be able to create a business case internally and reduce the mortality or increase the longevity of their members. So all of that really elevates our ability to access the market.
And it helps all of us. Helps Wysa, helps Swiss Re, helps the insurer as well. And we love working with you. So how do you envisage the future of mental health in the insurance landscape?
Well, during COVID and post-COVID, there's been a surge in interest from insurers around mental health. And we've had a lot of different use cases, some working with yourselves, some directly. And the one thing that we've seen is that where people already have a high risk, where people already have a cardiovascular or metabolic syndrome, where there is a person who's off work due to an injury, may not be a mental health claim. All of those, when you add in mental health support, you get drastically better outcomes. Mm-hmm. So a lot of people think that it's, preventative mental health is really important. Being able to address mental health as a risk on its own is very important. But the power of mental health in what we call the mortality multiplier or the claims multiplier of mental health in all the other kinds of claims is probably one of the things that I think most insurers will start focusing on because there's lots of great data coming out there.
So thank you for sitting down with me today, Jo. I guess just to wrap up, if there is one thing that you want people to remember, so with Wysa, outside of Wysa, to do with mental health and well-being, what would it be?
So Wysa uses AI to help you do more in your life and manage your mental health that way. But many people use AI as a companion to substitute for putting in the work on their mental health. Not so good.
Great tip. Thank you very much, Jo.